Some of the fear-free techniques that you would see in a fear-free, in a practice that has fear-free professionals working at it, and those are professionals that have been trained through the course. It's an online course that they take, and there's 7 modules, and they learn everything from transporting the animal into the hospital to how that animal is greeted in the hospital, to transport within the hospital. What's their experience? What are they feeling? What are they seeing? So our goal is to make it less stressful. So it even starts with the phone call to the client about educating them on a less stressful visit, or transport rather, to the hospital. Where are you putting your animal in the car? Is he having a stress-free ride to the hospital? What are we doing if you know your animal has anxiety? Like my own dog has anxiety. She is a ball of just nervousness. So I know, spray the car with pheromones well ahead of time before I get her into the car, and let that sit for 20 minutes, play calming music, have her securely fastened in the car. That way she's arriving at the hospital already kind of, low stress level. And then it's our job at the hospital to know, okay, do we take that animal right into the exam room, or maybe we let that animal sit in a nice, peaceful, calm car instead of, perhaps a more, rowdy exam room waiting area with dogs and cats and God knows what that comes through the door. And maybe they just go directly into the exam room. Do we provide visual barriers for those animals when they come in so they're not threatened by something else when they walk in? A good example of that is transporting cats. So a lot of times, owners may bring in the cats in their carriers by the handle on the top, because that's what the handle you think is used for, but the cat may be swinging inside back and forth, and all he's seeing is this and that. So we train them, carry it like a package, like a fragile package, and perhaps cover that with a towel that's sprayed with pheromones that helps them relax, and bring them in and keep them at a higher level so they're not down and feeling threatened by another, by a dog that's like, oh, I want to get you. So it starts with that, and then in the hospital, we're very, very aware of ourselves, our tone of our voice. I'm a loud person by nature, so I have to remember, fear-free, take it down, Janet, take it down. Our conversations are, if we're in an exam room, how many times do we go in and out of the exam room? How disruptive may that be to the patient? We have calming environment in terms of lighting, sounds, non-skid surfaces, or non-slip rather surfaces. So we put yoga mats on tables. We put things that are non-skid so the animals have traction. Because one thing that induces fear is slippery surfaces, right? Even we get scared with slippery surfaces. It produces fear. We're very aware of our sounds, our other sounds in the hospital, of other animals that may be perhaps having a procedure done or somebody coming in from emergency. Different species, if you're able to have cats separated from dogs, things of that would produce a more stressful or stressless, what's the word I'm looking for? A calmer experience for an animal coming in. So we're very aware of that. And then in the hospital, even walking animals through the hospital, we have to be aware of what are they seeing, what's going by. So we create paths that are least stressful for the animals going in. So they're not walking by animals that say maybe post-op from surgery, or maybe animals that have just come in on triage that are waiting to have their diagnostics run. Those animals come through a pathway that is low-key, not a lot of chemical smells. We try to keep that down. Sprayed with pheromones. We have cages already that are waiting for them that have non-skid surfaces that have already been sprayed. We play music. There's music cubes that Fear-Free has that is clinically proven to take the stress level down. So you can have that in the wards. Try to keep the wards as quiet as possible. Again, limiting the sounds of beepers and things like that may also be triggers for animals. Like my dog doesn't like fire alarms. She freaks out when she hears the fire alarm, and she's not right for days. So, but we also have monitors. We have fluid pumps. We have different types of monitors, especially say in CCU, that may mimic those sounds, and those could be triggers for fear as well. So it's getting your mindset into what are those triggers, and getting the education from the Fear-Free program that is written by behaviorists, that you read this and it's oh yeah, of course, this makes sense. I'm afraid when I hear those things when I go into the hospital. So really keeping those things in mind, getting the education for them really helps with that stress-free.